There is a herb sitting in most people's kitchen right now. You've probably cooked with it. You may have seen it in a health store. You almost certainly know its name, but I guarantee you have never heard what I'm about to tell you about it. Because what old doctors discovered, the practitioners who worked before pharmaceutical companies had a pill for every problem, is that when this herb is rubbed directly onto the spine every single night, something happens to chronic back pain that modern medicine still cannot fully explain. Not reduced, not managed, erased, in as little as 3 days. Now I know how that sounds. I'm a researcher. I was skeptical too. So before I tell you what this herb is, I need you to understand why it works. Because if you learn the name before you understand the mechanism, you'll dismiss it. You'll say, "Oh, I've heard of that," and you'll move on. And that would be a mistake. So stay with me for the next few minutes. By the time I reveal what this herb is, you'll understand something about your back pain that your doctor has probably never explained to you. Here is what we'll cover: the hidden cause of chronic back pain that most treatments never actually address, the exact mechanism by which this herb reaches that cause at the nerve root level, the precise method for applying it, because the method matters enormously, and the two types of back pain where this approach fails, and why one of them could be dangerous to ignore. That second type, I promise, will surprise you. Let's begin. According to the Global Burden of Disease study, back pain is the single most common cause of disability worldwide, with annual costs exceeding $100 billion in the United States alone. Most people who have lived with chronic back pain have been told one of three things: you have a disc problem, you have arthritis, or, the most frustrating answer, we don't really know. What they're rarely told is what is actually happening at the nerve level. When a disc bulges or degenerates, it triggers the release of a cytokine, an inflammatory protein called TNF-alpha, tumor necrosis factor alpha. This protein floods the tissue surrounding your spinal nerve roots and triggers a cascade of neuroinflammation, swelling, pressure, and pain that persists long after the original structural problem may have partially healed. Think of it this way. Imagine your spinal nerve is an electrical cable. TNF-alpha is the flood that fills the tunnel the cable runs through. Even if the cable itself is intact, the pressure from the flood crushes it. That crushing pressure, that is your pain. Researchers at the University of Virginia confirmed this in a study published in European Cells and Materials. They described current non-surgical treatments, including epidural steroids and TNF-alpha antagonists, as, in their exact words, neither effective nor safe. These are the treatments most pain specialists currently offer. Here is what that same research team found instead. The active compound in this herb, and we'll get to the name shortly, does something that almost no pharmaceutical pain treatment does. It works on multiple levels simultaneously. Level 1. It targets TNF-alpha directly. The University of Virginia study found that this compound significantly suppressed TNF-alpha-induced inflammation in dorsal root ganglion tissue, the cluster of nerve cells right where your spinal nerves exit the vertebrae. It did this through two molecular pathways, AKT and ERK. These are the same pathways that expensive biological drugs target. The difference is that this herb does it without suppressing your immune system. Level 2. It silences the pain signal itself. Beyond inflammation, your chronic back pain is being actively maintained by chemical messengers called neuropeptides, specifically substance P and CGRP, calcitonin gene-related peptides. These are your body's pain alarm bells. In people with chronic back pain, those alarms are stuck in the on position, firing long after the original injury has partially healed. The same University of Virginia research demonstrated that this compound suppressed substance P release in nerve tissue even at very low concentrations, and reduced CGRP expression in the dorsal root ganglion. In the animal model, pain sensitivity was measurably restored within 2 days of treatment. That is the documented biological basis for what traditional practitioners observed centuries ago. Level 3. It protects nerve cells from dying. This is the mechanism that most people never hear about, and it may be the most important one for anyone whose pain has been chronic for more than 6 months. When nerve roots are bathed in inflammation for extended periods, the nerve cells begin to undergo apoptosis, programmed cell death. Once nerve tissue is lost, pain signals don't disappear. They become amplified because surrounding nerves compensate. This is why chronic back pain tends to worsen over time even without a new injury. The University of Virginia research found that this compound, at therapeutic concentrations, completely prevented TNF-alpha-induced neuron apoptosis in isolated primary nerve cells. Using the TUNEL assay, the gold standard test for cell death, the untreated inflammatory group showed over 50% of neurons undergoing apoptosis. In the treatment group, virtually zero. Level 4. It may help regenerate disc tissue. The same research team observed an unexpected finding in the treated animals. Herniated disc tissue showed evidence of new collagen and proteoglycan formation, the structural proteins that keep spinal discs firm and hydrated. These are precisely the proteins lost in degenerative disc disease. A 2025 randomized, double-blind, placebo-controlled trial published in the Journal of Back and Musculoskeletal Rehabilitation found that a formulation containing this herb produced a 56% reduction in back pain intensity after just 7 days, and a 98.5% reduction by day 15. So, are you ready for the name? It is turmeric, Curcuma longa, the same root that has been used in traditional medicine for over 4,000 years, the same powder sitting in your spice cabinet right now. And the reason most people have tried it and felt nothing is that they were using it the wrong way entirely. What traditional practitioners understood, and what the research now confirms, is that curcumin, turmeric's active compound, is fat-soluble. It cannot penetrate the skin barrier on its own. It requires a carrier oil, and it requires one more ingredient that most people skip entirely, which is why they get no results. The preparation. Combine 2 tablespoons of high-quality turmeric powder, standardized to at least 95% curcuminoids, with 2 tablespoons of warm sesame oil or coconut oil. Then, add a 1/4 teaspoon of ground black pepper. That black pepper is not optional. Piperine, black pepper's active compound, increases curcumin absorption by a significant margin according to published pharmacokinetic research. Without it, most of the curcumin passes through without effect. With it, the compound reaches the tissue where it needs to work. Mix to a smooth, thick paste. The application. Apply the paste along the full length of the lower spine, from the tailbone upward. Use firm, circular massage strokes for 5 to 7 minutes. The massage matters. It drives the oil deeper into the tissue and promotes blood flow directly to the inflamed area. Leave it on for a minimum of 30 minutes. For best results, apply before sleep and leave it overnight under a breathable cloth covering. The body's tissue repair activity peaks during sleep. This is when the compound does its most important work. Apply every night for 3 consecutive nights. One honest note: turmeric will stain fabric and skin yellow. Use old sheets and old clothing. It is unavoidable and a small trade for what the research suggests this compound can do. For pain that has been present for more than 3 months. A 2025 randomized controlled trial found that combining turmeric with boswellia extract at 1,000 mg produced a 96% reduction in musculoskeletal pain scores within 6 hours. Oral supplementation alongside the topical application. 500 to 1,000 mg of turmeric extract with a fat-containing meal and black pepper. provides systemic anti-inflammatory support that reinforces the topical effect. Now, this is the section I promised you at the start, the two types of back pain where this method fails. Type 1, structural emergencies. Turmeric's mechanism is anti-inflammatory and neuroprotective. If your back pain is caused by a significant spinal fracture, severe stenosis requiring decompression, or in rare but serious cases a spinal tumor, turmeric will not address the underlying cause. Worse, by reducing your pain perception, it may mask a warning sign that requires urgent intervention. If your back pain started suddenly without any injury, or is accompanied by leg weakness, changes in bladder or bowel control, unexplained weight loss, or fever, do not attempt home treatment. See a physician immediately. This is the category I promised would surprise you, not because the herb is dangerous, but because the pain itself is telling you something you cannot afford to ignore. Type 2, gallbladder disease. Turmeric stimulates bile production. In an obstructed or inflamed gallbladder, this can trigger a painful episode. If you have been diagnosed with gallstones, consult your doctor before using therapeutic doses. Also note, at doses above 1,000 mg daily, curcumin has mild antiplatelet properties. If you are on blood thinners, warfarin, aspirin therapy, or similar, discuss with your physician before beginning an oral protocol. If any of these apply to you, leave a comment below. Tell me your situation. I read every comment, and your question may help thousands of others watching this who haven't asked yet. At the start of this video, I asked you to wait for the name, to understand the why before the what, because turmeric is a word most people have already filed away as ordinary. It is not ordinary. A peer-reviewed study at a major American research university found that its active compound prevented over 50% of inflamed nerve cells from dying, suppressed the primary cytokine driving spinal nerve pain, silenced the chemical messengers that keep pain signals firing, and showed early evidence of actual disc tissue regeneration. That is not a kitchen spice. That is one of the most studied anti-inflammatory compounds in clinical science, with, as researchers at the University of Virginia put it, negligible toxicity and multiple therapeutic effects. And it may be in your cabinet right now. If this gave you something your doctor hasn't, a mechanism, a method, a reason to try something different, a thumbs up takes 2 seconds. It tells YouTube this information deserves to reach the people who need it. That is not a favor to me. It is a favor to them. Subscribe for the next video, where we reveal the 5-herb combination that old practitioners used alongside turmeric for cases where turmeric alone was not enough. See you then.